We thought we'd give you a quick update about the trial progress, a few little changes, things to be aware of, and as I said, then hopefully a chance just for any discussion, any points, questions you want to raise. So feel free to put up your virtual hand, electronic hand, or write in the chat, and we can have some discussion. We've got just a few slides to go through, and so if we move on, and we are going to record it, the presentation. We'll leave the questions. We generally don't record the questions afterwards. We can, if there are questions, we can put them in the FAQs, but just for the presentation so that people who couldn't join can hear what the presentation was about. So, are we recording?
Yeah, we're recording.
All right. So, study update where we are. Well done. We've recruited 151 participants into the study overall, which is excellent. And it's been good to see a steady stream of patients coming in. We've now got 14 sites open. So again, we're opening sites all the time. Welcome to our sort of, I think, most recent site to open, Kings, and recruited the first patient last week. So we're very pleased about that. We've got more sites coming on board. So I don't know where all of you are from. So if your site's not open, we're really keen to get you open as soon as possible because recruitment is going well in the open sites, as you'll see on the next slide, but we haven't got enough sites open. So we do need more sites open to actually ramp up the recruitment rate. But we can show the recruitment by site on the next slide. As you'll see, the sites have been open the longest. Charing Cross and St Mary's getting close to, well, 50 patients for Charing Cross, close to that St Mary's. But it's been brilliant to see Bristol have been open for a while, getting into double figures. St George's, well done. Maria smiling. No, where is it? No, you're not. Maria's not. No, it was Vasiliki. I forgot which name it was. But St George's more recently opened and already at 10 patients, so well done. And the other sites coming on board. I know Sunderland been recruiting very well recently. They were a recent recruit. Still got to get Watford and James Cook off the mark. It would be good to let's get some patients in there. But again, I'm pleased that there is good recruitment across the site. So well done. Thanks very much for all your hard work at getting it, your sites open and recruiting. So just the last thing I'm going to say before I hand over to the team to explain a few things and what's going on in the trial. Just wanted to mention about the PCR results, particularly for new sites who are just trying to work out how this system works. So with this diagnostic, when you send the sample off for the PCR result, so this is the microbiological testing, it's a two-stage test. They first of all take the blood sample and look to see whether there is a PCR product that can be detected in the sample. If there isn't any PCR product, i.e., there is no pathogen, no bacteria or fungus there to detect, it should come up as being negative. And we can report that back. And so that's that first report that comes back on hopefully day one after you've sent in the sample. Obviously, it has to be received, so it takes at least overnight to get to us. We were just talking to the lab this morning, and they pointed out, though, this is quite a sensitive test. And so if there's any sign of a possibility of any DNA being there, it then goes on to the second stage, which is to sequence that genetic material and actually identify what the bacteria or the fungus might be. Now, it turns out often when you do that, because it's quite a sensitive test, that actually you can get little fragments of DNA detected that actually turn out not to be a clear bacteria or a fungus, in which case it might come back as negative. Or hopefully, what we obviously want to do is try and identify any bugs there. And then you will get that second result that identifies what the pathogen is, and that will come in a second email to you. So you'll get that result back on the second day. Um, and you'll know that that comes in sort of two formats. There's one of those bugs that we know are likely pathogenic, the staph, streps, Haemophilus, Klebsiella, Pseudomonas, E. coli, all of those common bugs that you might see in sepsis. But because this is a sensitive test, it also comes back with bugs that we have uncertain clinical significance, and you get those two different reports back advising how to change your antibiotic therapies if necessary. But as I said, it can also come back as negative that it turned out that that maybe weakly positive signal at the stage one turned out not to be a clear pathogen that gets reported back. So you may get that negative result. If you get the negative result, you also look at the PCR, sorry, the procalcitonin PCT, and if both are negative, then the idea is to stop the antibiotics. If the PCR result is positive, then you guide your antibiotic therapy accordingly. So just to explain that, I hope I made it clearer. If not, we can by all means ask some questions, and we can discuss that. So on the next slide, Janice, you're going to carry on from here?
I am. Yep. Okay. So just some housekeeping updates at this point. So obviously we're coming up to Christmas, which I hope we're all looking forward to. So we just wanted to highlight our Imperial College London closure days. So we are closed for the Christmas break, and because of that, the lab is also closed. So we've noted the last day for recruitment to be the 18th of December. So we have just a couple of weeks left to recruit, and then we will restart recruiting on the 2nd of January. And a little reminder there just to ask you all just to check your sample kits, so your blood sample collection kits, just to check your site level and just let us know if you need any more kits. But again, if you can let us know by the 18th of December, that will allow enough time for us to send the kits to you. So we close, our last day is the 20th of December. So our last day in the office is the 20th of December. But I'll update that shortly. Go to the next slide, please, Ravi. And just to note that Open Clinica also have some system downtime coming up just for a few hours early in our morning. So the system will be unavailable from 4 a.m. until 9 a.m. this Saturday. So we ask that you complete any data entry or randomizations before this time, and data entry maybe after this time. And then we just wanted to let you guys know about our ETMF. So I think this has been mentioned in our SIV and sort of earlier parts of the trial, but it's taken us some time to get the system validated and up and running. So the system is ready now for us to use. So we're sort of moving into a migration of transferring sites now into the ETMF EISF system. So that will take some time to do that. So we'll keep you all involved and let you know when your site will be transferring across. So we will be moving from paper files to electronic files. The ETMF system we are using is Florence. And we'll start using this system from January 25, but it will be a rollout. So we'll start from then, but we'll liaise with each site individually as to when we'll be transferring your information across. And in the interim, just continue to use your physical paper ISFs, just hopefully knowing that it won't be too much longer before you then transfer to the ETMF. Not sure if all of you have experience of the ETMFs or EISFs, but we're hoping it will reduce our printing, so our carbon footprint massively. It'll include electronic signatures, so less of a need to print something off and sign it, or PDF and sign separately. You can do it all through the ETMF system. So it should save us time and space, and it should help us to communicate. So the idea is you can use sort of the ETMF system to flag any, say, outdated CVs or GCPs. So you'll sort of get a little flag and you can arrange everything through this system. There is plenty of training provided. So again, we'll sort of we'll start rolling that out in the new year. We're just planning at the moment how to transfer all our paper sort of files of our eTMF into the system, and then we'll start moving then into the eISF. So hopefully it will all be very nice and straightforward, but it's a lovely system. I've used it before on another trial, so I'm hoping that you all enjoy it too. And I think that's all from me. I think I'll hand over to Ravi.
Thanks, Janice. So, as usual in the webinars, we've just got a few data entry reminders. These are just recent queries that we've had from some site teams, and we feel like it's beneficial to let everybody know the outcome. So, for the baseline blood results, when entering the bicarbonate results, please do not enter the base excess number. So this may be a negative number. We only want to record the bicarbonate result. If you enter the base excess number and that negative result, it will flag a query. So please just enter the bicarbonate result. Similarly, for any blood tests where the exact number is not specified, so you may have a result of less than 1 or less than 5, in this example, please enter the nearest whole number. And we are in the process of updating our ECRF completion guidelines to reflect this. We also have been made aware there is an issue where a query is being flagged for the day 180 follow-up. So for the day 180 follow-up, you have up to 14 days after the due date. But I believe if you are entering for the exact 14 days after the due date, it's flagging a query. In these scenarios, we ask you to enter the correct date and respond to the query, and we will review the date and close it. And we hope to correct this in a future amendment. Just a few other queries about the day 180 follow-up. So for some patients who unfortunately don't have capacity at day 180, or if you haven't been able to contact the patient, then please document this on a file note and send the file notes to our SepTiC inbox. If the follow-up is not done for any other reason, so you discover that the follow-up was not done within the 14 days because it was missed or due to site capacity, then this would need to be logged as a protocol deviation. And so we are trying to contact sites and send regular reminders for the day 95s and when the day 180s are due. So I believe all the sites should know when these follow-ups are due. But if you want to just double check at any time, please see your screening log, and that should have a follow-up calculator and tell you when the day 95, day 180, and the 1-year follow-ups are all due. And we have just included some recent questions that have been sent to our team. But as always, we constantly update our FAQ page on the website, and we will do after each webinar. So some recent FAQs we've received for open clinical data entry: should sites enter the antibiotics prescribed or given? We say that the site should enter the antibiotic regime that has been prescribed for the patient. And I believe this has been covered in previous webinars also. And as mentioned previously, you have 14 days, so 2 weeks from when the day 180 follow-up is due to contact the patient. And as previously mentioned, the dates can be found on your screening and follow-up calculator. Another recent query is if the patient does not have a PCT test done at the time of inclusion, but one was done prior to ICU admission, can this result be used? And the answer is yes, this PCT result can be used and must be done up to 48 hours prior to ICU admission. On the Open Clinical database, do we need to record the daily data form even if the patient is discharged to the ward? The answer to this is yes. So, as part of the secondary outcomes of the study in the protocol, we are collecting antibiotic data up to 28 days from randomization. So, if patient is discharged from ICU to the ward, please do continue to complete the the daily data forms. And a recent question that we received about other organ supports, so high flow nasal oxygen, CPAP, do these count as one of the two organ supports for GM-CSF? And the answer is yes, that these do count, plus vasopressors or renal replacement therapy. So just to take a pause, if there are any questions about any of these FAQs. Otherwise, we can just open the floor to generic questions.
Ravi, I might just add a little bit around that and the top one about the antibiotics. So what we
Yeah.
were talking about there is what the prescribed or given. It was literally if the antibiotics are missed, or I don't know, for whatever reason, only half the dose was given. I don't know. It was we're trying to capture what was the planned prescription. If the prescription was written up 3 times a day and then you stop the antibiotics halfway through the day, then obviously we want to capture then what was given on that day, I prescribed. So you would change. So what we were getting at was if the patient was receiving TDS each day, but one dose happened to got missed, you don't need to say that was a change. The plan was to give TDS that day and a dose just got missed. If it was TDS and on that last day you stop, then you're right, there was a change. We only gave 1 or 2 doses. And then the next day you would say that there was no antibiotics given. And similarly, the reason we're collecting on the wards is one of the important outcomes for antibiotic stewardship is the defined daily doses. So we do need to know what the patient got on the ward as well. So that was just a little bit about the extra bit about the antibiotics.
Thanks, Tony.
Christmas is not that far away, so it's inappropriate to make sure we wish you all a happy Christmas. I would say really push with as we saw you've only got 2 weeks left before we actually stop for Christmas. So we actually think hopefully that's a plus for you all. We'll have a little bit of time off over the Christmas period, certainly from this trial, just because of the labs being closed. It would be really good to, though, in these last 2 weeks, see if we get the recruitment numbers up. That last little bit because we've got our internal pilot review from the NHR based on the up till the Christmas recruitment is what will go into that report. So I was hoping we can get the last few recruits in before Christmas just to show the sustained recruitment. And then in the new year, we're very much these sessions, we want them to be helpful for you guys. So do let us know if there's anything you want to discuss, things like the API sessions we can help facilitate. Very keen for the APIs, maybe you want to run it, but if you want any help from us, let us know. But hearing what I think things that you're making it work at your site, things you're learning, it would be great for you guys to do that sharing of your learning. But as I said, if we can help facilitate or join whatever you'd like us to do, we're happy to do that. I wish you all well. Wish you a happy Christmas. Have hope you do get some breaks over the holiday period.